So when we do the laser, okay, at first you have this burn and we leave the dead skin in place. And although it doesn't look great, that serves as nature's Band-Aid. And it helps with the discomfort, and it has a lot of advantages in actually helping you heal more quickly than if you were to rub it off and have a raw wound. So for the first week or up to 7, 8, 9 days, you're going to have this raw face, and you're going to have oozing, all right? And this oozing is just the natural serum that is a reaction to the burn and to the healing. And sometimes this will coagulate, and you'll have kind of a yellow, pasty substance on your face. And this is nature's Band-Aid, so we don't worry about it too much. As it serves a healing function. You don't want to scrape it off or be overly aggressive with it. Now, we talked about the first day, right? We're just using the Vana ointment, and we're using the cold compresses. And then the second day, we're going to start washing. We can also use white vinegar soaks. Now, this may sound funny, but it's a time-tested situation that not only helps the pain, but it helps the acidity of the skin to fight bacterial infection. It helps dissolve some of the crusts that you get on your face, and it helps debride the skin. So it's useful. To do this, you take a teaspoon of white vinegar in a cup of water, all right? Don't try and add more or less. You think that the vinegar on raw skin would burn, but actually it's actually soothing. If there is some burning, you can put a little less than a teaspoon, but generally everybody tolerates a teaspoon in a cup of water fine. So you can take a couple teaspoons in a couple cups of water and put it in a bowl, like a cereal bowl, and you can take gauze, or you could even use Kleenex or paper towel, or a washcloth, and you want to soak it, get it nice and soaked up, and you want to lay that on your face, that vinegar soak, and just let it do just what it says. Let it soak for 5 or 10 minutes, and you can do that. I mean, really, you can do it every couple hours, but that's a bit of a hassle. So if you can do it a couple times a day, and this is over that first from day 2 until the rawness goes away, which is usually somewhere day 7, 8, or 9. So you can do the vinegar soaks. And if you can do that twice a day, that's great. People say, when do you do it? Well, I think a good time to do it is after you wash your face, so you don't have any ointment or anything. You do the vinegar soak, and then you can go back to your ointment. So remember, this first week, and give or take a couple days, that's really the worst time. That's when your face is raw, and you have the yellowish exudate, and it's just the tough time for the laser. And I tell people they won't like me that week. And remember, I've had it done myself. So when we get to this magic day, which in my case, I came back to work at day 9, okay? So, it was around day 8 or day 9 that my skin transformed from this raw burn into just a smooth red skin that doesn't have the exudate or the oozing. All right? And when that happens, and it's a little bit different for everybody, and it's, anywhere from days 7 to 10 for the average person, at that point we want to stop using the ointment. And what we're going to do is start using the Vana creme. All right? And this is a moisturizer. Again, it has no preservatives and no perfume. And you're going to put this on your face, and you're going to use this continuously. So, and actually, you don't want to use a lot of grease on your face for longer than that 8 or 9 day period, because that'll clog your pores. So we're going to just use this continuously. It's a moisturizer, it's very safe, and your skin's going to soak it up. So you put it on continuously so you have nice, soft, moisturized skin. Now, if for some reason you can't get the Vana cream, you can use Cetaphil gentle moisturizer, which you can get at the pharmacy, but we recommend the Vana cream. So at this point now, which is in your second week into this, you're still going to wash your face with the Vana cream cleanser, either the cleansing bar or more commonly the pump. You're still going to wash your face twice a day, and instead of applying the grease, now in the second week you're going to be applying the moisturizer. It's not uncommon that some areas will take longer to heal, especially under the eyes. So when your skin stops having that the kind of wet, oozing type of reaction, you can go to the moisturizer. However, if some parts of your face are still oozing and still raw, then you're going to continue with the ointment on those areas and the moisturizer everywhere else. But again, generally around 10 days, most of the oozing is gone, the raw skin is gone, and now you have the red or pink skin, and all you're going to need to do is wash your face twice a day, and you really don't need the vinegar soaks anymore. So at this point, it's just the Vana cream moisturizer and washing your face twice a day. By now, you're going to be done with most of your medications, and life should become a whole lot easier. In my situation, I was very glad to see that second week happen. Now, we'll be seeing you at our office usually at week 1 and at week 2, and our staff will help you with your skincare, make sure you're doing everything right, make sure you're taking your medications correctly, and just kind of follow you through your recovery. Now, when we get to the second week, then we're going to start thinking about sunscreen. Remember, we have new, raw baby skin on our face, and it's important to use sunscreen. And again, these Vana cream products are great because they're just, there's nothing in it. No dyes, lanolin, fragrance, masking fragrance, parabens, formaldehydes, and other preservatives, says the box. So it's a very pure product, and you'll start using your sunscreen twice a day. You do not want to burn a burn. So you don't want to get sun exposure on your face, and that includes walking in the parking lot or driving as the sun comes through the window. It will cause problems if you do that, so you want to avoid the sun. It's a good time to wear sunglasses and a big visor hat, and to use your sunscreen. All right, so I'm sitting here, I've got a lap full of products, I've got a lap full of paper and instructions, and what this all means is really that the laser resurfacing is something that is, it takes some time, it's a formidable recovery, it takes some planning, you have to have your ducks in a row, and you have to understand what to expect. I think this is one of the most dramatic procedures that we do, and you can look on my website and look at our before and after pictures. I mean, it literally can take decades and decades of aging away from the skin. But you can't walk into this blindfolded. You have to prepare, and I hope this video is helpful to you. If you have any questions, go look at the web page, and you can download our post-laser guide, and of course our staff is always here to help you. We hope that your laser experience is good, and this is Dr. Joe Niamtu, LoveThatFace.com. All right, so now we're going to talk a little bit about the healing that occurs with laser. And we say that the healing is 2 weeks, but really it's a bit of a hobby for about the first 6 weeks. And here's what you have to understand. We are burning off the old skin. So we're getting rid of the years of stress and sun damage and brown spots and freckles and wrinkles. And you're going to get new, what I call baby butt skin. So it's very sensitive, and it's going to go through a number of changes over the next 6 weeks. So the first thing we have is pinkness. So the first week we're raw, the second week we're red, and then we start our pinkness. And some people will stay pink for 2 weeks, some people will stay pink for 5 months. And it's not bright pink, and for women it's very easily covered with makeup. The good news is the longer you're pink, the more collagen you're making, and the better your result is going to be. So people that are redheads or blue-eyed blondes, they are going to stay pink longer. And this pinkness is kind of the bane of our existence at our office here, because it's something we have to deal with. And as much as we tell people that they're going to be pink for a while, they frequently forget and they get a little frustrated. So if you're going to go through aggressive laser, you're going to have this pinkness, and you have to get through this period. Women, again, are back in makeup at 2 weeks, and some men will wear makeup. My pinkness, lasted probably 2 or 3 weeks when I had my laser procedure performed. So there's really not a lot to do to treat this. When you're pink, and one of the things you want to make sure is that, number one, you're not washing too aggressively with a washcloth or something abrasive. And number two, that you're not putting something on there that's irritating your skin that your skin doesn't like. And I want to tell you something. I just went over all of these lotions and creams and potions and told you exactly what to use. It never fails. People will use other things. They'll try aloe, or they'll try some internet stuff, or some vitamin E or something. Don't do it. Only use the 4 things that we're talking about, okay? The ointment, the moisturizer, the cleanser, and the sunscreen. If you put other things on your face thinking it's going to help, it can make it worse, and especially make the pinkness worse. Now, if you are pink after that 2nd week, you can use over-the-counter hydrocortisone. That helps some patients, but you just have to be patient and remember that this is a little healing process. The next situation that we commonly encounter is called post-inflammatory hyperpigmentation, or PIH. Hyperpigmentation is a blotchy tan, almost looks like you put on self-tanner and didn't get it on evenly. And this is a response to healing and really a response to irritation. Now, the darker your skin, in other words, people with brown eyes, brown hair, and people that tan easily or have that olive-colored skin will hyperpigment a lot easier than your patients with less melanin, like redheads or blue-eyed blondes. But about 30% of the population, or 40%, will hyperpigment. Hyperpigmentation classically happens almost at 1 month. And what happens is you start to get this brown, splotchy appearance on your face, and we talk about it preoperatively. However, some people forget about it and they're a little surprised. So what do we do about this? Number 1, we want to get that sunscreen going as soon as we can as our skin heals. So we're going to use that in week 2. We want to protect ourselves from the sun. Now, any irritation can accelerate the hyperpigmentation, and it could be sunlight, it can be overhead lights, it can be your hair dryer or your car defrost blowing on this healing skin. So we just want to be very gentle with our skin, and if it hyperpigments, it's not a problem. It's never a permanent situation in my experience, and we'll put patients on bleaching cream, and that will improve that over several weeks, and it's just a phase that we go through with the healing. So we talked about extended redness, we talked about hyperpigmentation. Some people get itchy, and this is usually in the 1st or 2nd, or the really 2nd or 3rd week. If you have this type of itching, you can use over-the-counter hydrocortisone, you can take Benadryl. These things will help. A couple other things. Infection is really rare with laser resurfacing. Generally, the manifestation of an infection is pain. So if you have severe onset of pain, we need to know about that, as it could possibly be an infection. But again, they're very rare. You want to wash your hands before you touch your face, and you don't want to touch other body parts and then touch your face, or you don't want to touch public surfaces, doorknobs, and touch your face, because that's how people can get infected. And again, it's rare, and you should be on an antibiotic to begin with. Some people will get some acne breakout, or what's called acne flare, after their procedure. It's not uncommon, and it's generally self-limiting, or we may put you on an antibiotic. Some people may get milia, which are little white dots which represent clogged pores, and we see that because of the ointments and lotions. Again, these are usually self-limiting. One of our goals is to get everybody back on skincare as soon as we can after their laser. So ideally, you want to be on Retin-A and bleaching cream before your laser, and you want to get back on those products as soon as you can, which is usually about a month after your laser. And it's just like if you get your car painted, you're going to wax it and you're going to take better care of it. We want you to take better care of your skin. Scarring is very